For history and present illness, I have Adeline as a 42-year-old female with painful, heavy menstrual bleeding with intermittent bleeding between periods for the last 3 months. Chief complaint is heavy, irregular periods. For subjective data, I have what is your typical menstrual cycle, what color is your period, how's the flow, and are you passing any clots? On your heaviest day, how often are you changing your pad or tampon, and do you need to change it at night? Do you get any other symptoms when you get your period? Besides pain, what makes the symptoms better or worse? Are you currently taking any medications, prescription, over-the-counter, and or herbs? Have you ever been told you're anemic or have a bleeding disorder? Are you sexually active? What is your relationship? Do you use contraception or protection and do you feel safe in your relationship? Findings later indicate that she is not on any contraceptives because her husband has had a vasectomy. How were your deliveries for your 2 children? What type of deliveries did you have, and were there any complications to you or the baby? Have you ever had an OB or GYN surgery? Any abnormal cervical history, and any history of infections? For objective data, I would like full vital signs, general survey. I would check the skin, hair, body habitus, viralization, or hirsutism. For the neck, I would check the thyroid. For breasts, I would check for any discoloration, masses, or nipple discharge. For the abdomen, I would check masses, pain, tenderness, or hernias. For genitalia, external abnormalities like clitoral megaly, imperforated hymen, atrophy, vaginal agenesis or septum, and then I would also check the vaginal mucus. I would also perform a bimanual exam to check the size and shape of the uterus and ovaries. For labs, I would like an HCG, TSH, CBC, FSH, LH, estradiol, coagulation, ultrasound, endometrial biopsy, and a cervical pap culture. For assessment, she's diagnosed with I'm going to say this wrong, I'm so sorry. Menorrhagia, that was butchered. Dysfunctional uterine bleeding. So for the plan for diagnostics, I would do a CBC to rule out anemia, bleeding disorders, and or bleeding disorders. I would also like an ultrasound to rule out fibroids. I would also do a pap culture to rule out infections, and a biopsy to rule out endometrial carcinoma, polyps, and hyperplasia. For non-pharm interventions, I would recommend exercise and diet to reduce period symptoms and mood. I would advise her to limit or avoid caffeine, salt, and dairy because that can help reduce inflammation and lighten periods, and also the use of heat pads. For pharmacological interventions, I would recommend over-the-counter NSAIDs to reduce cramps and the amount of bleeding. I would also like to put her on combined oral contraceptives to stop ovulation and lighten the periods. I would recommend orthotricycline. So the first phase would be 0.18 milligrams of norgestimate with 25 micrograms of ethinyl estradiol, and it would increase from 0.18 milligrams to 0.215 milligrams to 0.25 milligrams. And this is 1 pill daily for 28 days. For patient education, I would tell her to start the pill on the first Sunday after her period starts and to try to take it around the same time every day, best without food. And if she was to miss a pill, I would tell her to take it as soon as possible. If she misses more than 2 pills, I would tell her to take whatever is scheduled next, and then we can reevaluate different types of birth control options since the pill is not effective in the sense of taking it on time. I would advise her to stop taking the pill if she starts to experience any severe persistent headaches, any vision changes, calf pain, chest pain, but emphasize chest pain, not breast pain, and any weakness or numbness to the arm or leg. And I would also warn her that if her periods are heavy enough to the point where she's changing her pad and tampon and or tampon every 2 hours or passing large clots, to call me as soon as possible and or go to the ER. I would not refer to anyone else, and for follow-up, I would recommend 4 months to evaluate how the birth control is going for her.